Hi, I'm Dr. David Schechter. Today we're going to see a panel of patients who've been diagnosed as tension myositis syndrome and who've been through a successful MindBody treatment program. I brought this group of people together because I thought it would be important for patients who are going to go through this program to learn from some of the techniques and methods that successful patients have utilized in getting over their problems. Hearing their stories will help us to understand how people going through this process get over their pain. Let me tell you a little bit about my story. 23 years ago, I was a first-year medical student at NYU, and I was having knee pain, and it wasn't going away. My outlets were basketball and running, and I was finding that I was not able to participate in these activities. These were the hobbies I had that helped to burn off the tension and stress of medical school, and I really started to miss them. Because of the continued pain, I saw the student health doctors at NYU. They diagnosed it as tendinitis, and they recommended anti-inflammatory medications. I didn't get better. So the next referral was to an orthopedic surgeon who was the New York Yankees team doctor. And he examined me, did certain tests, and concluded that I should try another course of anti-inflammatory medications and leg strengthening exercises. I diligently did the exercises. My legs got stronger, but the pain didn't go away. So in desperation, I walked into the office of Dr. John Sarno, a physician who had lectured to us in the anatomy course. I knew that he specialized in physical medicine and rehabilitation, so I went in there hoping to get some specialized physical therapy treatment that might solve my knee pain problem so I could return to sports. What I heard that day not only changed the course of my pain, but also helped focus my medical career. Because when I told Dr. Sarno about my symptoms and the treatments that I had tried, his comment was, much of this chronic pain is actually psychosomatic. How do you react to that? And I said I was a little bit surprised to hear it. But he invited me to attend a lecture seminar that he gives to patients who've been diagnosed as TMS, or tension myositis syndrome. So I went to the seminar, and what he described to me that evening made a tremendous amount of sense to me in terms of my personality, kind of a worrier, in terms of the symptoms that I had, and in terms of a mechanism by which stress and tension could create or perpetuate physical pain, usually in the back or neck, sometimes in the legs, sometimes headaches or other symptoms. By the time I left that evening and went home, I felt like a weight was beginning to lift off my shoulders, and that weight was my fear and anxiety that my pain in my knees was not going to go away. Within the next few weeks, my pain was essentially gone, and I returned to running and playing basketball, and the pain gradually went away completely. This made me quite a devotee of this diagnosis and approach, and I shared it with medical students at NYU and with my professors as well. Many were resistant to the idea. Medicine is quite focused on molecular biology and on the aspects of science that you can look under a microscope and see, and not as concentrated or not as comfortable with psychological approaches and techniques. Nonetheless, I've continued to apply these principles in my practice, and now, years later, have developed my own approaches, techniques, and methods to treating and diagnosing tension myositis syndrome. What we'll see today is the results of those treatments and methods in listening to this panel of patients tell their stories of the pain that they had, how they were diagnosed, and what techniques and methods they used to get over the pain.